Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see Knowledge Booster Dose Part 20, particularly one-liner questions and their answers with added explanation, Part 5. My dear students, we have already seen 19 videos on the Knowledge Booster Dose. If anybody has not seen the previous Knowledge Booster Dose videos, please go in the channel's playlist and watch all the Knowledge Booster Dose videos because they are very important for your GPAT Niper DI Pharmacist exam. First question of today's session is nothing but the name the antacid which causes diarrhea. So answer for this question is nothing but the magnesium ions, antacid containing magnesium ions. So basically antacids, they are classified into two types, systemic antacids and non-systemic antacids. So what antacid will do? Antacid will neutralize the acid which is already formed in the stomach. They will neutralize the acid by chemically reacting with the already formed acid. Okay. In the antacids you have two subtypes, systemic antacids and non-systemic antacids. In the systemic antacid you have example of sodium bicarbonate. In the non-systemic antacids you have examples of aluminum hydroxide gel and magnesium trisilicate sodium carbonate, right? Systemic antacids, they have certain adverse effects. Systemic antacids crosses the membrane, it goes into the systemic circulation and will alter the pH of your blood. So for example, sodium bicarbonate is a systemic antacid and it will go in the blood, it will change the pH of blood, it will shift the pH of blood towards the alkaline side, and that is known as systemic alkalosis. So sodium bicarbonate has a systemic alkalosis as the adverse effect, urinary alkalosis as the adverse effect. It also causes the rebound of acidity, that is another adverse effect. Okay. Again, sodium bicarbonate is contraindicated in the hypertensive patient. That's why non-systemic antacids like aluminum hydroxide gel, magnesium trisilicate, these are known as non-systemic antacids. They are not absorbed in the systemic circulation. They will neutralize the acid and their reaction product will be removed in the form of pieces. Aluminum hydroxide gel and magnesium trisilicate, these two non-systemic antacids, they are combined together. Why? What is the reason? Because they are combined together to nullify the adverse effect of each other, to counteract the adverse effect of each other. Why? Because aluminum ions will cause constipation. Remember, aluminum ion containing non-systemic antacids like aluminum hydroxide gel will cause constipation, will decrease the peristalsis, right? Now magnesium ion containing non-systemic antacid will cause diarrhea, and that's why to counteract the adverse effect of each other, they are combined together. So remember, the antacid which causes diarrhea, that is the magnesium hydroxide. The antacid which causes the constipation, that is the aluminum hydroxide gel. Now the antacid which causes the systemic alkalosis is nothing but the sodium bicarbonate. The antacid which causes rebound of acidity is nothing but the sodium bicarbonate. The antacid which causes the epigastric pain, flatulence, that is again a sodium bicarbonate. So in a one question I am going to explain the answer in such a manner that you can at least cover 3-4 more questions. Now let's move to the next question. Question number 62. The powerful centrally acting antiemetic. Basically they are asking the centrally acting antiemetic example. It is nothing but the ondansetron. Basically this ondansetron, they are not only centrally acting, they are also act by peripherally. So ondansetron, what is that? Ondansetron is an antiemetic drug. So it acts by blocking the serotonin receptor. It blocks the 5-HT3 receptor. 5-HT3 serotonin receptor in the central as well as in the peripheral. So it blocks the 5-HT receptors. It decreases the vagal tone. It decreases the vagal tone. That is known as the most powerful acting centrally antiemetic. Ondansetron, granisetron, these are the examples of 5-HT3 receptor blocker, 5-HT3 antagonist. Now remember, these cetrons, ondansetron, granisetron, they are the drug of choice in case of chemotherapy induced vomiting or radiation induced vomiting. So anti-cancer drugs like chemotherapeutic agents or anti-cancer drug or antineoplastic drug, they have adverse effect that they will induce the vomiting by irritating your GIT. So in that case, cetrons, ondansetron is the drug of choice in case of chemotherapy induced vomiting, and also a drug of choice in a radiation induced therapy. Radiation induced vomiting. You have to remember this. Okay. Now in that also you should remember what are the different types of receptors of serotonin. So serotonin has at least 8 receptor. 5 1, 2, 3, 4, 5, 6, 7, 8. Out of that, 5 is known as a ion channel, and other 7 receptor, they are known as a G protein coupled receptor. In the 5 okay, in the serotonin receptors, you have different kind of receptors. 5 5 5 4 5 6 7 8. So out of that, 5 is a ion channel, and rest of the 5 receptor or serotonin receptor, they are known as a G protein coupled receptor. Okay. Now next question of today's session, that is a metoclopramide is a antagonist to which receptor? So metoclopramide is a which receptor antagonist? So basically they are asking metoclopramide is an antagonist to which receptor? So answer is nothing but the dopamine receptor, that is a D2 receptor. Metoclopramide again it is known as a prokinetic drug. It is also used as an anti-emetic drug. It is also used in the vomiting, but it is a prokinetic drug. So by blocking this D2 receptor in the chemoreceptor trigger zone in the brain, it decreases the vomiting, it decreases the emesis, right? So metoclopramide is basically prokinetic drug. So it is used in the treatment of vomiting, diarrhea, gastro, efflux reflux diseases, and vomiting due to other conditions like labyrinth disturbances. Now again, question number 64. Myelosuppression caused by methotrexate is rescued by. Myelosuppression caused by methotrexate is rescued by which drug? So basically you should know what you mean by myelosuppression. So I will explain the answer first. The answer is nothing but the leucovorin. Leucovorin is the answer. I will explain this answer. What is meant by myelosuppression? Myelosuppression is nothing but the suppression of your bone marrow. So most of the anti-cancer drugs, they have adverse effect of this myelosuppression. So myelosuppression means they will suppress your bone marrow, and that's why they will suppress or they will decrease the formation of RBC, WBCs, platelets, etc. etc. So that is known as a myelosuppression. Most of the anti-cancer drug, they causes the myelosuppression. RBC का count कम करेंगे, okay, WBC count कम करेंगे, neutropenia, thrombocytopenia, etc. etc. What is the methotrexate? Methotrexate is nothing but the anti-metabolite anti-cancer drug. So methotrexate is a folic acid antagonist. It is a folic acid antagonist. It prevent the utilization of folic acid, conversion of folic acid to dihydrofolic acid, which is a very important component for one carbon atom transfer reaction in the cell. So it is basically folate antagonist. Methotrexate is a folate antagonist. So it is an anti-cancer drug. Now what happens due to blocking of synthesis of folic acid? So there is a deficiency of folic acid, right? Folic acid is very important for the synthesis of DNA and further protein synthesis and all that. Actively dividing cells will be suppressed. In that case, in case of bone marrow suppression by methotrexate, what you have to do? You have to supply the precursor. What is the precursor? That is a folinic acid. So folinic acid is known as an anti-leucovorin factor. Folinic acid is known as anti-leucovorin factor, and that is nothing but the leucovorin. So myelosuppression caused by methotrexate is rescued by leucovorin or folinic acid. It is also known as a folinic acid. Remember. Now question number 65, you will see anti-breast cancer drug having endometrial antagonistic action. Basically they are asking example of anti-cancer drug which is having endometrial antagonistic action. So what will be the example of this drug? So answer is nothing but the raloxifene. Raloxifene. So you might have seen, you might have heard this raloxifene, tamoxifene. So they are the similar drug. Tamoxifene, raloxifene, they are the similar drug. So what is the mechanism of action of this drug? So they are known as a selective estrogen reuptake modulator. So they are known as a selective estrogen reuptake modulator. So modulator means they will also act as an agonist to the estrogen receptor, and they will also act as an antagonist to the estrogen receptor. So basically they increases the apoptosis, programmed cell death, by antagonizing these estrogen receptors, and will prevent the expression of genes and will cause increase in the apoptosis. So raloxifene and tamoxifene and raloxifene, they are known as a selective estrogen reuptake inhibitor. You have to remember this, right? Now we'll see the question number 66. Myelosuppression caused by 5-fluorouracil is rescued by. Myelosuppression caused by 5-fluorouracil is rescued by. तो बहुत ही सिंपल क्वेश्चन है, आपको थोड़ा सा लॉजिक लगाना है. What is a 5-fluorouracil? It is again an anti-cancer drug. It is a thymidine. It is a thymidine antagonist. Thymidine antagonist. This fluorouracil will inhibit one enzyme, thymidate synthase, and will prevent the synthesis of thymidine nucleoside. What happen? There is a faulty synthesis of DNA and cell will die. Right? So it is an antagonist to the thymidine. So obviously myelosuppression caused by 5-fluorouracil will be rescued by again that thymidine. So thymidine is a precursor compound. You have to supply that. So myelosuppression caused by 5-fluorouracil can be rescued by thymidine. Now we'll see the next question. Question number 67. Hemorrhagic cystitis is the side effect of. Basically पूछा है hemorrhagic cystitis is the adverse effect of. So hemorrhagic cystitis means what? There is a inflammation, there is a irritation in the urinary system. There is a inflammation, there is a irritation, and there is a bleeding inside your tubules. So that is the hemorrhagic cystitis. Now this is the adverse effect of one another anti-cancer drug. So hemorrhagic cystitis is the adverse effect of one anti-cancer drug known as a cyclophosphamide. So cyclophosphamide will cause hemorrhagic cystitis. So it is the most important adverse effect. Cyclophosphamide will cause hemorrhagic cystitis. Now cyclophosphamide is a prodrug. ये होता है prodrug. When it will go inside the body, it is converted into active metabolite. So cyclophosphamide is converted to aldophosphamide, and aldophosphamide is converted into mustard. That is a nitrogen mustard. Okay. There is a generation of also one more metabolite known as a acrolein. So cyclophosphamide is converted into aldophosphamide is converted to mustard, and one more metabolite known as a acrolein. Now that acrolein causes the hemorrhagic cystitis, right? So acrolein causes the hemorrhagic cystitis. Now if there is hemorrhagic cystitis, what will be the treatment? What will be the antidote? Or you can say what will be the antidote of cyclophosphamide? So antidote of cyclophosphamide is nothing but the mesna. Mesna, M-E-S-N-A, mesna. Mesna means what? It is a sodium salt of thiasulfonic sulfonate. Sodium salt of sulfonate. It is a sodium salt of sulfonate. So that is a cyclophosphamide. So that is a mesna. Mesna is a antidote for hemorrhagic, or it is a treatment for hemorrhagic cystitis caused by cyclophosphamide. Now we'll see the next question. Nephrotoxicity caused by cisplatin is prevented by. Again, yes, cisplatin is nothing but the anti-cancer drug, and it causes the nephrotoxicity, renal impairment. Nephrotoxicity or renal impairment caused by cisplatin is treated by, or it is prevented by. So what will be the drug? So the answer for this question is nothing but the amipostin. Amipostin is the drug which is used to prevent the nephrotoxicity caused by cisplatin. Now cisplatin is again a alkylating agent. क्या होता है? Cisplatin is a platinum compound used in the cancer. So it is alkylating agent. When it will go inside the cell, it is converted into a reactive free radical. Now that free radical will bind to the thymine in the DNA, will cause synthesis of faulty DNA. Cell will die. Now amipostin is nothing but the one compound known as a free radical scavenger. So it will bind to the free radical generated by the various anti-cancer drug like cisplatin, again free radical generated by radiation therapy. So amipostin is the drug which is a free radical scavenger. So it will scavenge free radical, it will neutralize that. So that's how it can prevent the nephrotoxicity caused by cisplatin. Now we'll see the next question. Name the drug which is a Philadelphia chromosome tyrosine kinase inhibitor. Name the drug which is a Philadelphia chromosome tyrosine kinase inhibitor. So name is nothing but the imatinib. Imatinib is a monoclonal antibody which is against it is known as a tyrosine kinase inhibitor. So imatinib is a tyrosine kinase inhibitor, and it is used in the treatment of leukemia. So in the leukemia or blood cancer, this Philadelphia chromosome that is expressed in a pathological value, or that is expressed more in the blood cancer or leukemia. So this imitinib is a tyrosine kinase inhibitor. So it will bind to the tyrosine kinase and will inhibit it and prevent the further phosphorylation of various proteins. And there is a suppression of formation of more cells. So that's how this imitinib is a Philadelphia chromosome tyrosine kinase inhibitor. Now we'll see the next question. Monoclonal antibody against the CD20 cell. So monoclonal antibody against the CD20 cell, it is nothing but the rituximab. क्या है? It is again a monoclonal antibody rituximab. So it is against the CD20 cells. Now how it is against the CD20 cell? So there is one disease known as a myeloma. These cells, all these cells, myeloma cells, and then all the different cells. So they will have a antigen on their surface. They will have an antigen on their surface, and that antigen, so rituximab binds to that antigen, and it is a monoclonal antibody against the your CD20 cell. Remember, you have to remember. Now we'll see the next question. Question number 71. Probenicid inhibit the reabsorption of uric acid in the which part of nephron? So probenicid क्या है? It is a uricosuric drug. So it will increase the excretion of uric acid. Probenicid क्या है? It is a uricosuric drug. So it will increase the excretion of uric acid. Right? So it is used in the treatment of gout, arthritis, gout, uric acid excretion enhancer. Now it inhibits the reabsorption of uric acid in which part of nephron? So answer is nothing but the proximal convoluted tubule, PCT. So it inhibits the absorption or reabsorption of uric acid in the PCT. Now this probenicid is sometimes combined with the penicillins to increase the duration of action of penicillins. So penicillin G and probenicid, they are combined together. Now probenicid also used in the treatment of gout to decrease the uric acid level of the body, right? Now we'll see the next question. Next question is nothing but the question number 72. Febuxostat inhibits. So basically they are asking the what is the mechanism of action of febuxostat. So febuxostat inhibits. So it is nothing but again a drug used in the treatment of gout. Gout में use किया जाता है, and it is a drug related to allopurinol. So you might got some idea what will be the mechanism of action. So as allopurinol is also xanthine oxidase inhibitor, febuxostat is also xanthine oxidase inhibitor. So inhibition of this xanthine oxidase enzyme. So what is the role of this xanthine oxidase? So it is involved in the formation of uric acid from the xanthine, right? So from the xanthine, from the purine metabolite. So purine का conversion ये करता है xanthine में, xanthine का conversion करता है uric acid में. Now that is inhibited by this febuxostat and allopurinol. So both are the drug used in the treatment of gout. Now next question we will see. Question number 73. Antidote for acetaminophen. Basically they are asking the what is the antidote for paracetamol. Antidote for paracetamol. So what is antidote? You might know that is N-acetylcysteine. Okay. But most of the students they know only one antidote, N-acetylcysteine. But methionine is the alternate antidote. So if N-acetylcysteine is not available, then methionine can be used. You should know when there will be toxicity of paracetamol. Paracetamol is a very safe drug. It is a very safe drug. And what is the normal dose of paracetamol? It is around 500 milligram to 1 gram once a day, twice a day, or thrice a day. That's it. So in that dose, it will not going to affect your liver. It will not going to cause hypertoxicity. It will not going to cause toxicity. So what is the dose responsible for the toxicity? So dose responsible for the toxicity is nothing but the if you take a paracetamol beyond 6 gram per day. So this was again a question. So 6 gram per day paracetamol is a toxic. So that will cause damage to your liver. But why it causes damage to the liver? Because there is generation of one toxic metabolite. And what is the name of that toxic metabolite? So name of that toxic metabolite is nothing but the N-acetyl para-hydroxybenzoquinone imine. NBQI. You might have seen N-acetyl para-hydroxybenzoquinone imine. That is a toxic metabolite of paracetamol. Now that is generated if you take paracetamol beyond 6 gram per day. Okay. Now that metabolite react with the hepatic cells and causes the hepatic necrosis. Okay. Now you may have doubt in your mind when you are using normal dose of paracetamol whether that metabolite is generated or not. So in the normal dose of paracetamol also the toxic metabolite is generated, but that is generated in a very less amount, very less quantity, and that is easily removed from your body by glutathione conjugation. Now, in case of overdose, in case of paracetamol toxication or repeated paracetamol beyond 6 gram per day, so in that case, there is generation of large quantity of that N-acetyl para-hydroxybenzoquinoamine. Now, in that case, that metabolite is removed from body normally via glutathione conjugation reaction. But when there is a overdose or when there is a large amount of metabolite in your body, so glutathione level is limited, so it is a saturable. So only limited amount of metabolite is removed, and remaining amount will cause hepatotoxicity. What is the antidote? N-acetylcysteine and methionine. So N-acetylcysteine and methionine, these are the antidote for paracetamol poisoning. How they will decrease the, or how they will remove that toxic metabolite from body? So N-acetylcysteine, by providing the sulfonyl group, so it increases the glutathione reduction level of your body, and that's how the metabolite can be easily removed from your body. Okay. Next question we'll see. Question number 74. Name the anti-tumor necrotic antibody commonly used against or commonly used in the Crohn's disease. So what do you mean by Crohn's disease first? Okay. So we'll see the answer. So answer is nothing but the infliximab. So infliximab is a monoclonal antibody against the tumor necrotic factor used in the Crohn's disease. So what do you mean by Crohn's disease or Crohn's disease? So it is also known as ileitis. It is also known as ileitis. So जो इलियम पार्ट होता है आपका लार्ज डिस्टेंस का, उसमें अगर इन्फ्लेमेशन होता है, so that is known as ileitis. Ileitis. Okay. So Crohn's disease is also known as ileitis. Ileitis, right? So there is the inflammation of your rectum. Okay. So there is a release of inflammatory chemicals, tumor necrotic factors, and all that. Due to that, there is an inflammation pain in the your rectum. So that against that tumor necrotic factors, infliximab is the antibody, right? Now next question: what is the mechanism of aspirin? Mechanism of aspirin. So very simple question. So it is a irreversibly inhibit the COX-1 and COX-2, non-selective inhibitor of COX. So irreversible inhibitor of COX-1 and COX-2. So remember question आ चुका है, irreversible inhibitor of COX-1 or COX-2. That is a aspirin. Non-selective irreversible inhibitor of COX. That is a aspirin. So it is a acetylsalicylic acid, right? It will prevent the formation of prostaglandins, thromboxane A2, etc., etc., and will prevent the inflammation, pain, and fever, right? Now, aspirin is also antiplatelet. So by inhibiting the COX-1 in the platelet, it prevents the platelet aggregation, and it is nothing but the antiplatelet drug. It is used in the prophylaxis of myocardial infection, prevention of myocardial infection, in a dose of 75 to 150 milligram. You have to remember this dose. So whatever I am explaining you, whatever lines I am telling you, so on every line they have already asked question. So what is the dose which is responsible for the platelet inhibition? So 75 milligram to 150 milligram. So in a lower dose, it inhibits the platelet aggregation. In a higher dose, it exerts its anti-inflammatory effect. So you have to remember this, okay? Remember, it is a irreversible inhibitor of COX-1. The only irreversible inhibitor, that is a COX, that is aspirin. Next question. Question number 76. Warfarin affects the which pathway? Warfarin affects the which pathway? So what is warfarin? Warfarin is an anticoagulant. So it affects which pathway? There are two pathways of blood clotting. First one is known as intrinsic pathway. Second one is known as extrinsic pathway. Okay. So warfarin affects the extrinsic pathway. Warfarin affects the extrinsic pathway. Now, what is the mechanism of action of this warfarin? So warfarin inhibit one enzyme. Warfarin inhibit one enzyme responsible for the epoxidation of vitamin K. So vitamin K epoxidation reductase enzyme. Vitamin K epoxidase reductase enzyme. So that enzyme is responsible for the reduction and oxidation of your vitamin K, which is coupled with the clotting factors. So inactive clotting factors will be activated simultaneously when there is a oxidation and epoxidation of your vitamin K. So that enzyme is inhibited by this warfarin. Okay, so it acts on a extrinsic pathway. Remember, warfarin is a 99% plasma protein bound drug. Warfarin is known as a rat poison. Originally, it was a rat poison to kill the various rats and mice. It is a rat poison. It is 99% bound to a plasma protein. Most of the drugs they will have drug-drug interaction with the warfarin, and warfarin is nothing but the anticoagulant. So it is a inhibitor of one enzyme responsible for the epoxidation of vitamin K, which is coupled with the activation of clotting factors. Right. So you have to remember. In a one question, I used to explain a lot of things. Next question we will see. Question number 77. Basically, this was question in once in GPAT. What is the site of action of heparin? You should know what is heparin. Heparin is an anticoagulant. It is a natural anticoagulant present in your blood. So what is the site of action of heparin? Site of action of heparin. So a lot of students they will think the site of action of heparin is nothing but the blood, but it is wrong. So what is site of action? So correct answer is nothing but the liver. How I will explain this. So heparin is a natural anticoagulant in the blood. First it was isolated from liver. That's why it is known as a heparin. Now most of the students don't know about the heparin. What is heparin? It is a mucopolysaccharide. What is it? It is a mucopolysaccharide. It is a mucopolysaccharide. First thing. Remember another thing. It is the most basic compound in the body. It is the it is the most acidic compound in the body. Heparin क्या है? It is the most acidic compound in the body because it is a salt of sulfuric acid. Heparin is the most acidic compound in the body. What will it do? It will inhibit the synthesis of vitamin K dependent clotting factors in the liver, and that's why the site of action of heparin is nothing but the liver. Now, as it is the most acidic compound in the body, heparin क्या है? Most acidic compound in the body. So if there is a toxicity of heparin, what is the antidote? So if there is a toxicity of heparin, there is an antidote known as a protamine sulfate, and that is the most basic compound. Okay, so remember the site of action of warfarin is the liver. We will see the next question. Heparin toxicity is treated by, as I told you, protamine sulfate. Remember, protamine sulfate is a specific antidote for heparin toxicity. So protamine sulfate is a basic compound, heparin is an acidic compound. Remember. Now next question we will see. Clopidogrel toxicity causes which kind of hematological deficiency? Again, clopidogrel is also anticoagulant, so it will cause this neutropenia, decrease in the neutrophil level of your body. Right. Now question number 80. Last question. AB6-Zimab binds to which glycoprotein receptor? So again, AB6-Zimab is a monoclonal antibody used as an anticoagulant. So AB6-Zimab is a drug which is a monoclonal antibody used in the platelet aggregation to prevent the platelet aggregation. So it binds to glycoprotein receptor known as a 2B3A. Glycoprotein receptor 2B3A. These are the receptors present on the cell surface of your platelets. So by inhibiting this receptor, this AB6-Zimab prevent the platelet aggregation. You can order this magic bullet for GPAT Niper DI Pharmacist. Read twice and qualify 100% with very good rank in a very short period. It's our guarantee. You can contact me on this number. You can see we have very much promising results from past few years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course where you will have live lectures, recorded lectures on a Wednesday, Saturday and Sunday. So lectures will be subject wise and chapter wise. Study material is available in the form of hard copy that will be shipped to your address. Online test is also there. Everything is included in the 8,000 rupees only. And if you get all India rank below 20 in the GPAT exam, your fees will be returned to you in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100